In today's video, we'll discuss 10 silent stroke signs that should never be ignored. Strokes, which have been medically termed cerebrovascular accidents or CVAs, rank among the top causes of mortality in the USA annually. Each year, over 795,000 individuals suffer strokes, with about 87% of these accidents resulting from arterial blockages that obstruct blood flow to the brain. Prompt medical intervention is crucial once a blockage is detected in order to prevent irreversible damage, as brain tissue deprived of oxygen deteriorates rapidly. While many are familiar with the classic signs of a stroke, a brief review is always beneficial. Strokes manifest abruptly with a range of symptoms, including heightened skin sensitivity, facial and limb numbness, speech impairments like slurring, unilateral muscle weakness, coordination issues, and difficulty swallowing. To swiftly and easily recognize stroke symptoms, utilize the acronym FAST. F represents face. Request the individual to smile. If one side of the face sags or exhibits paralysis, this may signify a stroke. The letter A in FAST stands for arm. Simply ask the person to lift both of their arms. If one of their arms appears weaker or fails to lift up, this could be an indicator of a stroke. The letter S denotes speech. Ask the person to recite a simple sentence or even to sing a tune. Slurred or unusual speech is a critical warning sign, as the letter T stands for time. If any of these signs are observed, immediately call 911 or seek urgent medical care. Prompt intervention is essential in order to minimize permanent damage. Having reviewed the classic stroke symptoms, let's now focus on silent strokes, which according to some research may constitute the majority of stroke cases in the USA. Many individuals experience silent strokes without even realizing it, and consequently, they don't seek out help. Awareness is vital because untreated strokes are a leading cause of dementia. Now let's proceed to discuss the 10 symptoms of a silent stroke. But first, please support our channel by liking this video. Subscribe if you haven't already and hit the notification bell to stay informed about our latest content. Share this video with your friends and family to spread awareness about silent stroke prevention. Remember that prevention is key to avoiding CVAs, and equipping yourself with this knowledge can save lives. Symptom number 1, pain. Strokes can result in pain that varies in duration, from episodic and transient to persistent. This pain can appear on the face, in a specific limb, or even on one side of the body. Such discomfort can signal an onset of other symptoms, like a reduction in strength in the affected area. Additionally, stroke-related pain can manifest as a headache due to elevated intracranial pressure. Importantly, this pain is oftentimes described as having a burning sensation. Symptom number 2, hiccups. One often overlooked symptom of a stroke is getting the hiccups. Surprisingly, a stroke can trigger hiccups that last for an unusually long duration, sometimes persisting for several hours or even sometimes several days. If prolonged hiccups occur in conjunction with other stroke indicators, such as unilateral numbness or weakness, it is critical to seek immediate medical attention. Number 3, fainting. Fainting is another frequently overlooked symptom that can indicate a stroke. While many conditions can cause fainting, such as malnutrition or low blood pressure, it is crucial to consult a healthcare professional if fainting occurs, particularly in individuals with risk factors for stroke. Early medical evaluation can help differentiate between benign causes and more serious underlying conditions like a stroke. Symptom number 4, seizures. Seizures are another symptom of a stroke. Some stroke cases can manifest as seizures, making it crucial to take note if an adult who does not have a prior history of epilepsy suddenly experiences a seizure. Immediate medical attention is necessary in such instances, as it could be a sign of a stroke. Symptom number 5, memory lapses. Lapses in one's memory are another common symptom linked to strokes. If you notice gaps in your memory, such as forgetting parts of your day or how you arrived at a destination, it's essential to seek medical advice promptly. A more alarming sign is the sudden inability to form new memories following the onset of a stroke. Number 6. Vomiting and nausea. Identifying the presence of vomiting and nausea, particularly when accompanied by sensations of dizziness or vertigo, serves as a crucial diagnostic criterion for distinguishing stroke from other medical conditions. Unlike other ailments, the nausea that stems from a stroke usually manifests without concurrent stomach pain or diarrhea. Symptom number 7. Dizziness. Dizziness, often underestimated, warrants careful attention as it too can actually be a manifestation of a stroke. It is imperative not to dismiss such symptoms, but rather to maintain a vigilant awareness of their potential significance. Number 8. Sudden drowsiness. Drowsiness is commonly associated with physical exhaustion, extended periods of wakefulness, or insufficient sleep. However, the drowsiness associated with a stroke is unique. It emerges suddenly, devoid of any discernible warning or apparent trigger, and it tends to endure. Individuals experiencing this type of drowsiness may unexpectedly fall asleep, sometimes even during conversations, and may also be difficult to awaken. Symptom number 9. Neuropsychiatric manifestations. Psychotic episodes can emerge as a manifestation of stroke, with isolated cases illustrating them as the sole symptom. It is imperative to recognize that these symptoms frequently appear abruptly and without preceding indicators. Individuals affected by such episodes often lack prior medical conditions or relevant medical histories. Symptom number 10 of silent strokes is disorientation. Observing challenges in orienting oneself regarding time, location, or memory may indicate a stroke, often accompanied by short-term memory loss. Seeking medical attention promptly upon recognizing any symptom to include disorientation is absolutely essential. There are reports indicating that some individuals have experienced multiple mini-strokes, exacerbating symptoms and potentially culminating in dementia. Now that we have an understanding of stroke symptoms, it's pertinent to explore the underlying causes and the available treatments for cerebrovascular accidents. Among the primary and widely recognized triggers is hypertension, significantly increasing the risk of stroke by 2 or even up to 4-fold. Another prevalent contributor is cardiac ailments, particularly arrhythmias, with atrial fibrillation notably associated with a 6-fold increased stroke risk. However, strokes aren't solely attributed to arrhythmias. Various other conditions, such as myocardial weakness, cardiac dilation, or thromboembolic events, significantly contribute to their occurrence. Tobacco use substantially heightens the likelihood of suffering a stroke, doubling the risk for smokers and quadrupling the risk of a hemorrhagic stroke. The increased risk stems from smoking-induced inflammation and a higher susceptibility to aneurysms. Diabetes, surprisingly, is another prevalent factor, as elevated blood glucose levels can compromise blood vessel integrity. High cholesterol levels also significantly contribute to stroke risk. Additionally, obesity and a sedentary lifestyle are pivotal factors, as they are linked to hypertension, cardiovascular disorders, and other previously discussed symptoms. So, what exactly are the treatment options for stroke? Treatment strategies are tailored based on the stroke's stage and the specific symptoms. The initial focus is on halting the stroke's progression, followed by managing its aftermath and implementing preventative measures against future occurrences. Each case demands individualized care, particularly with silent strokes posing distinctive challenges. Physicians must carefully assess the risk and benefits of available treatment modalities. Prevention of subsequent silent strokes hinges on proactive interventions, primarily centered on controlling associated risk factors. By effectively managing these risk factors, it's feasible to prevent 9 out of 10 stroke incidents. The most effective approach to mitigating stroke risks is to adopt healthier lifestyle habits. Embracing a lighter, nutritious, and physically active lifestyle contributes to maintaining a healthier body with minimized risk factors. This entails adhering to a balanced diet, participating in routine exercise, and constantly monitoring and managing symptoms in collaboration with a healthcare provider. If you found this video informative, please show your support by hitting the like button. Share it with your loved ones so they too can become aware of the 10 silent signs of stroke that should not be ignored. Subscribe to the channel if you haven't already and enable notifications to stay updated on our future uploads. Were you aware of these silent stroke indicators before watching this video today? Share your thoughts with us in the comments section below. Thank you for watching, and we look forward to seeing you for our next video. Goodbye, take care.